on LBC. Call 0345 6060 973.
10 minutes for 8 is the time. We'll come back to the COVID issue in just a moment. More of your calls. Sean, you will be the next caller. There does seem to be a geographical problem there which you need to drill through. But let's talk about other matters and a multi-million-pound fund to boost adult social care workforce. Tens of millions of pounds being diverted in that area. And here with more details, Conservative MP and Care and Mental Health Minister Gillian Keegan joins me. Good to have you on, Minister. Where's the money going? How will it be spent? Good morning to you.
It will be spent between now and March on short-term workforce pressures. So you'll hear from many people, I think the CQC today, but from many care home people who work in the care sector, that there are massive pressures on this workforce. And first of all, as the Care Minister, first time on as Care Minister, I just want to say a massive thank you to the 1.5 million people who work in social care. And it's always got elements of pressure because it's a growing demographics, there's a growing need every year. But of course, we've got a huge competition for labour at the moment. So it's there to make sure that we can get some extra capacity in the system to see us up to March.
Will it help with what I read? Is there a growing problem with providing mental health care as well, particularly for young people as a result of the pandemic? No one's fault. Appointments couldn't be kept, and now there's a bit of a tsunami of folk who need attention, Minister.
There's separate monies for that. So we've got £500 million, which we put in place for mental health recovery to increase the number of appointments, particularly for young people as well, children and young people, but also for adults across the system. So that was to get, I think, 345,000 extra appointments. So it's or extra people seen. So we have put £500 million into the mental health recovery. And of course, across the whole piece, 5.4 billion into recovery of our NHS electives, etc. OK,
so you're in the care and mental health field. When I next see you in the House of Commons, will you be wearing a mask, Minister?
Well, I did wear one yesterday because I've developed a bit of a cough, so I didn't want to be... Yeah, exactly. Well, I mean, everyone looks at you strange now if you've got a cough. So I did wear one yesterday. I think as we get into winter, and I think more and more people start coughing and spluttering, I think many more people will wear masks. But it is, as we've said, an individual choice. We've all been educated on this in the last sort of 19-20 months. So we don't need to tell people what they need to do, how many times they need to wash their hands, etc. We've all been educated on this, and I think the British people are showing a lot of common sense, actually. I mean, many people are wearing them in the tube, and if you go into crowded rooms or offices, many people are wearing them on the way in as they're moving round.
Right. So do you subscribe to the Jacob Rees-Mogg view on all of this, do you, Minister, that you're all a convivial bunch and the Conservative parties all get on so well you don't need to wear masks?
Well, he's been there longer than I have, so maybe he knows people more. But no, I mean, it's not because, I mean, obviously, COVID doesn't look at whether you get on with someone or not. It's an infection. But I do think it's important. We know we're going to have challenges over winter. That's why we've set out the Plan A, Plan B. That's why we're trying to get everybody the booster jab. And one thing I just wanted to say, as well as the booster jab, is also from today, young people aged 12 to 15 can actually go on the national booking system and book a walk-in or a GP. So it's the first time they've been able to do that if they haven't had their jab at school.
Do you think, when is the gap between the second jab and the booster? Currently, I believe it's 6 months and 1 day. That needs to come down, doesn't it, Minister, to 5 months?
Well, the JCVI are the people who look at all the evidence. They were the people who advised 6 months. They look at the data all the time, lots of different data. So, they're the people who will make the decision if it has to change. They have changed between dose timing in the past. They've changed, from 3 weeks to 12 weeks to 8 weeks. That has adapted as they look at the various data that they have. But it's only them that could give us that advice. But our job, if they do...
Are you asking them? I mean,
we ask them to look at that all the time. So,
right.
How to optimise, our vaccine deployment. But if they do, then all I can say is we will be ready to do whatever it is they advise us on.
You say that, Minister, but obviously you won't necessarily be aware of this, but I'm taking a lot of calls from people around the country. There does seem to be a regional issue here, and that you're absolutely right. In some instances, in southwest London, people are being contacted that they're in their 50s and they're saying, come along, you can have your... And in others, we've got people in their 70s who can't get their booster jab. Have we got a regional problem, Minister?
No, we haven't, but it is more complex as a rollout because of this 6 months, or whether it was 5 months or 6 months, because what happened in the first rollout is within your age group or within your if you had some specific issues, cohort, you went forward, everyone went forward in that cohort. Obviously now you've got this factor of not more, 6 months and 1 day, and it does add a bit of complexity, but we had the most amount of bookings on Wednesday this week, which is 234,000 in the national booking system. So no, I don't think we've got regional issues at all. We've set up. We've got more vaccination centres than we had this time last year. We were used to doing it. We set up, but it is a bit more complex.
Why the slip in the numbers being vaccinated? What do you put that down to, Minister?
I think it's just there's the cohorts that are open, the amount of people who can be done. I think there's about more than 4 million who have been done. But, not, I mean, I can't come forward, for example, because my last jab was not 6 months.
Ridiculous.
Well, I'm over 50.
Wow.
I'm over 50. I don't know how the 50-year-old has got their jab that early. But, there is that complexity.
You lived a blameless life. You look far, far younger.
Well, many people have been coming in on the chat now, I'm sure. No, it is slightly more complex, but I have no doubt at all.
You're honestly telling me that there are stocks all around the country, Minister? You're
yes.
confident? Okay,
yes, we're confident in the stocks, we're confident in the GPs, we're confident in the supply, we're confident we can do it. The booking system obviously is there to be used. It's slightly more complex because of this 6 months and 1 day, so it does add a complexity, but I'm pretty sure that, that this picture will change. If you remember at the beginning of the vaccine deployment, the first couple of weeks, there was the same tension.
Yes.
Everybody's so desperate to get it, why haven't I had it? My neighbour's had it, somebody else's friends had it, etc.
I wonder just lastly if I can get a little bit personal about a couple of your colleagues, because in that first rollout it was vital that the government was seen to be on the front foot and doing all the media appearances, and there was the great Zahawi, the great Nadeem Zahawi, fielding the questions, forcing through like a winger in rugby, racing up to score a try. That was the great Maggie Throop. And not being personal at all, but she is a minister. Where is she, Minister?
No, I sat next to her yesterday when she gave a statement
I'm very pleased
in the
to
House.
hear it. But where is she on the media?
With our masks on. Was she? I mean, I'm here today.
And it's great to have you. But you will agree that the great Zahawi was a tremendous performer on the media, wasn't he?
Yes, and he's been an MP for longer, and Maggie's been a minister for 3 weeks. But don't underestimate Maggie. She is a biomedical scientist, and she has an awful lot to offer in this space. So she will be out and about. She will get the delight of meeting you soon, I'm sure, Nick.
Well, just lastly, in the same level of time that she's been in place, we had 0 appearances on the media. The great Zahawi, 17. Why is she hiding away?
She's not. I mean, Per and I have both been in these new posts, for 3 weeks today. 3 weeks today.
All right.
I mean, that's not a lot of time. And actually, she's very much focused on obviously getting to grips with her brief and getting the boosters rolled out across the country. And as I say, she was in Parliament twice yesterday answering an urgent question and also giving a statement. But don't underestimate her. She's got a lot to offer, and she is, as I say, a biomedical scientist. So she's a great fit for the role.
If you can mutter through her mask to come and have a chat with me, I would be most grateful. Thank you very much indeed for your time. Gillian Keegan, who is a Care and Mental Health Minister, appearing here. Congratulations on your appointment. Sorry, I should have said that. Congratulations on that. Last quick call. Sean in Chelmsford, 30 seconds. Have you had your vaccine? Good morning.
I have, yeah. And I think for me, the frustrating thing is we're now seeing this plateau in terms of numbers and the uptake, and we're now